Julie, let's get into pre-exposure prophylaxis. First of all, some people might want to say what that is even. So can you talk about that? And then we want to talk about, how do we identify people for that? And then we can talk about what interventions there are.
Sure. Pre-exposure prophylaxis, or PrEP, is the use of HIV antiretroviral medications that have been historically used for treatment, and instead using them for prevention. So my favorite analogy for PrEP is birth control, that it's generally a daily pill that you can take to prevent HIV if you're at risk of acquiring HIV. We can also talk about other ways of taking it. So for some populations, just taking it around the time of sex, specifically for men who have sex with men, has been shown to be effective. Yeah, I mean, we can also talk about in terms of who's appropriate for PrEP.
Right, yeah. How do we figure that out?
Really similar, I think, to the indications for HIV screening in terms of HIV risk factors. So HIV screening is recommended universally, but in particular for people with HIV risk factors. So the USPSTF and CDC have identified certain groups that are good candidates for PrEP, including MSM, who are sexually active and have a partner living with HIV, or use condoms inconsistently for anal sex, or have a recent STI. And it's kind of similar for heterosexuals, although STIs are really limited to syphilis and gonorrhea for that group, excluding chlamydia. And then for people who inject drugs, anybody who shares drug equipment or has any of the sexual risk factors.
Yeah, and my understanding is that frequently women, especially maybe women of color, kind of underestimate their risk. I think that's a problem. I don't know. I don't have much experience with that, but I don't know, Allison or Colleen, whether in your...
I think when we think about even how the CDC reports how women acquire HIV, they say the risk factor is women who are having sex with a high-risk partner. And so if you ask the question like that, of course they're going to underestimate their risk, right? So, if you're living in a high-incidence zip code and you say, are you having sex with a high-risk partner? No, I have had one partner, and no, I'm not. However, just living in that zip code, your partner is at higher risk of being HIV. And so we have to, I think about how we couch those questions and, again, routinize how we offer treatment, or testing, and then offer PrEP. And I think that is when people are going to put themselves in, oh, yeah, I could be potentially at risk.
I think there's two things that are really important when you're thinking about assessing someone who might be a good candidate for risk. And the first thing is understanding your local epidemiology. So like you were saying, understanding what's going on in your community. What does HIV transmission look like in your community? Are you in a place where there is high prevalence and new infections that are still turning up, like many places in the Southeast? Or are you in a place where, there's maybe not a lot of transmission ongoing? And then identifying people who might be good candidates, either from having multiple partners or having condomless sex with multiple partners who have had an STD in the past, a sexually transmitted infection. Those might be people who you first start the conversation with. But honestly, anyone who's sexually active outside of a relationship, a monogamous relationship with an HIV negative partner who wants PrEP is a candidate for PrEP. Right.